We do like to have this available for people who are unable to attend today. So thank you so much for registering for this. My name is Sandy Padgett, and I am the Executive Director of Consumers Council of Missouri. And we are here today with Ed Weisbart, who is going to talk about the differences between traditional Medicare and Medicare Advantage. But first, I'd like to tell you just a little bit about Consumers Council. We are a nonprofit consumer advocacy organization based in St. Louis, Missouri. We work to level the playing field by Missouri consumers by focusing on affordable utilities, equitable banking opportunities, and affordable health care for all in Missouri. A lot of people don't know about our work. I like to say that we're one of the best kept secrets. In the area of utilities, all major utilities that cover the St. Louis area and most of Missouri have implemented rate increases recently. That includes electric, gas, sewer, and water. And what Consumers Council does is we get involved in those proceedings. We work to decrease the rate increases that have been proposed, and we've been able to do that. And we also work to maintain and expand customer assistance programs for those who can't keep up with the rate increases. In the area of banking, we've collaborated with others to ensure that local banks are doing business equitably within their service area. And that has led to the establishment of branches in areas that were formerly banking deserts. And we know that this is really important because when people don't have access to banks, they're more likely to go to payday loan centers. And that prevents the accumulation of intergenerational wealth when you are stuck with a payment plan that keeps you behind for most of your life. And in the area of healthcare, in addition to Ed's annual webinar, we have a new focus. We're looking at the prevalence of medical debt in Missouri. We've brought on 2 MSW researchers who found that Washington University Physicians Group and St. Louis University's Physicians Group were the primary enforcers of medical debt collections in the St. Louis region. And in addition to that, we also found that medical debt is impacting people inequitably. Zip codes with higher percentages of Black residents and lower median incomes faced more lawsuits, higher judgments, and more wage garnishment orders. We are dependent on individual, community, and foundation donations or grants in order to keep Consumers Council going. So I'm going to put a link in the chat to our website. This is offered for free, but if you would like to donate to us, of course, we would welcome that. And we also have a fundraiser coming up on October 5th, which I think will be a lot of fun. We have Dr. LJ Punch, who will be our keynote speaker. He's been very active. He's not only a trauma surgeon, but he's also been very active in the tornado impacted area. And he will talk about how the St. Louis response to the tornado has affected the building of equity and healthy communities in the St. Louis area. Many of you know Ruth Erisman. She's going to be honored. Dr. Ed Weisbart is also going to receive an award, as is Bernie Hayes. So now I'd like to introduce Ed Weisbart, MD. He is the former president and vice president of Consumers Council. He is currently the National Board Secretary and Missouri Chapter Chair of Physicians for a National Healthcare Program, which is a nonprofit, nonpartisan organization of more than 25,000 physicians and other healthcare advocates in support of a publicly financed, nonprofit, single-payer national health insurance program that would fully cover medical care for all Americans. He's a former family medicine physician. He practiced family medicine for 20 years at Rush Medical Center in Chicago. He moved to St. Louis in 2003 to serve as the chief medical officer of Express Scripts until retiring in 2010. He volunteered as an assistant professor of clinical medicine at Washington University in St. Louis from 2004 until retiring clinically in 2021. He has extensive history across a variety of healthcare environments. He's a national speaker with dozens of articles published in both national medical journals and local media regarding healthcare needs of the uninsured. He'll talk today about the differences between traditional Medicare and Medicare Advantage. And in other past presentations, what's very interesting to me is that he will point out some of the false promises of Medicare Advantage plans. I've had personal experience with this recently because my mother, when she turned 65, she signed up for a Medicare Advantage plan. She broke her hip. We tried to get her into the preferred rehabilitation hospital in Jacksonville, Florida, and her United Healthcare Medicare Advantage plan refused that. And so she ended up in the less preferred rehab hospital, which none of us were very happy about. Regarding Medicare Advantage, Dr. Weisbart has explained they make more money the less health care you get. And this was referring to financial incentives that are present in Medicare Advantage plans for the insurers. So we will have time for questions and answers at the end of Dr. Weisbart's presentation. I'd like to ask that you please mute yourself. If you don't, if I hear some background noise, I will probably go ahead and mute you. So I hope that's okay. If you have questions, please put them in the chat. And with that, I am going to turn it over to Dr. Weisbart.
Hey, thanks, Sandy, and thanks, Sal, for coming, and thanks for inviting me again. And I always look forward to this. It's a field that changes a lot. So yeah, you heard my background is I spent time focusing on single-payer national healthcare, and we are not going to be talking about that today. We're going to be talking specifically about a decision that folks have to make in their own lives. Hopefully get to single payer. You won't have to make this decision, but that's not here today. So today we need to make, people, you yourselves or people in your family facing Medicare enrollment have a choice in the road. And the reason I like doing this webinar is because I don't think a lot of the really important information is clear to folks. I think most folks are a bit confused about the choice, a bit confused about what Medicare is, what traditional Medicare is, what Medicare Advantage is, what Medigap is. So I'd like to tell you that there's a one-size-fits-all answer for everybody that I'm just going to tell you to go do, but that's not the case. It's a very real decision based on your particular circumstances. You may find one fork in the road more sensible for you personally than the other fork in the road. But my goal today is to help you better understand the decision that you're trying to make. So we'll tell you sort of how things work today at a high level so you understand the difference between these programs, and then point out some of the pros and cons along the way. And at the end, show you some pitfalls to avoid and some tools to help with the decision beyond this relatively brief discussion that we're going to be having. That's kind of the run of show, what we're hoping to do. I'll be telling you some stories from my family, and not to worry, I have their permission to tell them to you. So let me start by showing you some slides. I believe you can see them now, yes? So that's kind of what we're going to be talking about. But to start, let me introduce you to my mother-in-law, because she was the world's finest mother-in-law. She passed away a couple years ago, but before she did, she gave me her permission to tell you this story. Ma lived in Florida, and she had she passed away when she was 94 and 10/12 or 11/12, almost 95. And about 12 years before she died, she revealed she showed up as having an unknown disease, a cardiac disease, pretty uncommon cardiac disease that is called hypertrophic cardiomyopathy. And it presented in her early 80s. She didn't know she had it. It's probably genetic, and I'm hoping my wife doesn't have it, but we don't know yet. It's a fatal illness. It's progressive chest pain and shortness of breath and exhaustion, and it started to develop in her and was rapidly progressive, as it often is. And she was pretty darn sick. So it's a uncommon disease to begin with, and it's frankly rare in people in her age group. So we looked around, something rare, and you don't want to be treated by just anyone. You want to find people who are really expert at treating that. Turns out there's, as far as we could tell 10 years ago, there was literally nobody in the state of Florida who had focused on treating this particular condition. So we flew Ma from Florida to St. Louis, where I live, where a lot of you live, and where it happens that St. Louis Washington University has one of the country's three centers for treating this condition. So we flew her here. She got arguably world-class healthcare. Spent most of a week in the hospital. Spent a few weeks recovering with us here where we live, and then went home. And she did fabulously. It's a really good decision to bring her here. She had since then she had two major orthopedic surgeries, which she couldn't have lived through, and she really no significant signs of the condition came back after this. So hooray! Her ultimate passing away had nothing to do with this at all. So why am I telling you about this? What does that have to do with anything? Well, because my mother-in-law had traditional Medicare. So I'm going to be using that phrase, traditional Medicare. You may hear other people using the phrase original Medicare, and that might confuse you. What's the difference? Somebody said traditional, somebody said original. Those are synonyms. So don't be confused. You hear somebody saying traditional Medicare or original Medicare, they're talking about the exact same thing. They're just synonyms. And they both refer to the original form of Medicare from 1965. It was passed in 1965. And that's two parts, Part A and Part B, in case you're wondering. So Part A, as you probably know, is the part of Medicare that covers inpatient hospital type stuff. Part B is the part of Medicare that covers outpatient type stuff mainly. And that's what I mean when I'm talking about traditional or original Medicare is Part A and Part B. And as we'll talk about a couple times later on as well, traditional Medicare comes with, as its major problem, a 20% coinsurance for outpatient stuff. So you have to pay 20% of all the outpatient stuff you get, and then a significant deductible for every inpatient hospitalization. So more than, I think it's $1,700 in 2026. And there's no upper limit on how much that can accumulate to. So if you're pretty healthy and you wind up needing one doctor visit every year and you have to pay 20% of that, most folks can deal with that. But you have health insurance for when you're sick, not when you're healthy, mainly. And so if you get sick and you have to see a physician, let's say once a month or once a week, or maybe 2 or 3 times a week for some treatment, and you wind up getting slammed in the hospital a couple times a year because you're sick, that those copays and deductibles with no upper limit can bankrupt you. So 90% of people who are in traditional Medicare don't want that bankruptcy exposure, and they get what's called Medigap. So that's I call it Medigap. Some people call it Medicare supplemental, and those are a range of policies with their own letters from A to N, I think, and they basically are all designed to reduce or eliminate the copays and the deductibles. I'll mainly talk about the one called Medigap Plan G, because that's G for good in my mind, but there are others too. But anyway, my mother-in-law had traditional Medicare and Medigap, and as a consequence of that, she could go anywhere she wanted to go. She could come to St. Louis. If she had had Medicare Advantage, those usually come with much, much more restrictive networks, seldom letting you go outside of your region and to not even everywhere within your region. So I'm pretty confident that if she had had Medicare Advantage, she would not have had insurance coverage for the $100,000 or so of care that she needed to save her life here in St. Louis. But she had traditional Medicare and Medigap, so she could come anywhere, and we decided that this was the best place, and she did. And I'm the logistics person for most of the folks in our family. That's how my brain works. So if she had needed permission to get this care here in St. Louis, it probably would have been me setting up the permission. I never called anybody. There was, traditional Medicare did not require her to get any permission. She'd just go where she thought was best. and she didn't pay a penny. She had a Plan F supplement, which you can no longer get, but there was zero out-of-pocket expense for her Medigap, thanks to her Medigap. Never paid a penny, and didn't even have to deal with any of those, surprise medical bills that a lot of folks have to deal with when they go home. That never happened. So it was completely no cost, the cost of care for her. So she loved it as her insurance, and she was very confident that it would be there for the rest of her life, which it was. So 30, almost 30 years. And if you talk to her about changing that insurance, she would get very unhappy, and you would have to deal with this version of my mother-in-law, which I did, and you don't want to, believe me. So, okay, so what is this stuff? Traditional Medicare, Medicare Advantage. First, let's talk about traditional Medicare. It's almost as simple as this cartoon that I'm making for you. So there we are on the left, and we pay our taxes. And as a result, when we turn 65, the federal government sends us our precious red, white, and blue Medicare card, which we cling to for dear life. And then with that card, we can go to almost any doctor or hospital in the country, and Medicare pays the doctor or hospital on our behalf. It's almost as simple as I drew it. So that's not at all the same thing in Medicare Advantage. So Medicare Advantage is so different from traditional Medicare that there are actually bills being promoted in Congress to prevent them from using the word Medicare because it's completely different. It's also unclear to whom the advantage goes, as I'll show you. So there are people who call it Medicare Disadvantage. I just call it Medicare Advantage because that's what everybody knows it as, or maybe MA. So at any rate, Medicare Advantage is quite different from traditional Medicare. Instead of the government paying doctors and hospitals on your behalf, the government actually prepays the insurance companies that we've grown to know and love on our behalf. So they're prepaid a fixed dollar amount every month for us, and then they're supposed to then pay doctors and hospitals on our behalf when we go see them. So they're prepaid for this, which means that the money is in their bank account. So every time you then go to get health care, that's money that they're spending, and their business model is to not be thrilled about that if they can avoid it. So one of the things that they do is they have selected networks where they say, oh, you can go to this doctor and not that doctor. If you go to that one, you can go, but you'll have to pay more, and not that hospital, this hospital, not so they really try to influence where you go for your health care. For a number of reasons, one of which, of course, is for their own profits. So they do a number of things differently than do people than traditional Medicare. The first thing to notice, of course, is my cartoon now is far more complicated. It's far more complicated. So one thing which I pointed out is that the networks are smaller, and actually they're quite a bit smaller. With traditional Medicare, you can go almost anywhere. If you have Medicare Advantage, there's a decent chance that you won't be able to see all the doctors in your community. In fact, 12 million people in Medicare Advantage can't see as many as 70% of the physicians in their county. And indeed, if you're African American, the odds that you can see one of the black physicians in your county are less than you would expect, and same thing for Hispanic physicians. So they're underrepresented. Aside from how many fewer physicians of color there are, they're even less represented by Medicare Advantage. So anyway, chances are you have a much smaller network of people that you can go see. Unlike traditional Medicare, for the most part, this is Medicare Advantage is where you start seeing the HMO
Right.
kinds of tools. So prior authorizations and things that traditional Medicare almost never does. Because they're prepaid and don't particularly want to have to pay for your healthcare expenses, they are much happier to attract you if you're healthier, and they don't advertise or promote themselves quite as much if you're sicker than that. They have remarkable overhead and profits. They have overhead that's probably in the 15%, and then profits on top of that, and then hidden overhead. And at the end of the day, they're paid about 35% more for taking care of people than the same people cost when they're in traditional Medicare. So if you decide to go into Medicare Advantage, the insurance companies will be paid up to 35% more than what traditional Medicare would be needing to spend on you because of the overhead and the profits and other things built in. So it's an interesting difference. Let's make it a little bit more clear what the difference is as a consumer or as a patient. So we'll talk about traditional Medicare versus Medicare Advantage, and then we'll also talk a bit about Medigap there in the middle. So as I said, with traditional Medicare, you can go to almost any doctor or hospital anywhere in the United States. You have to pay this co-insurance. I got to fix that for outpatient care. And then this hospital deductible updated for 2026 is now north of $1,700 pretty soon. And that's for as many as 3 hospitalizations per year. No limit. It adds up without a limit. It doesn't have a lot of the benefits we think of as really medically important, like a hearing benefit, hearing aids, or a vision evaluation and glasses. No dentistry, no pharmacy benefit. So if you want those things, you have to either pay out of pocket for them, or you have to buy a supplemental policy unrelated to any of this. And most people do purchase a drug benefit for about $60 a month, but none of that's included in traditional Medicare. And so that's why people in traditional Medicare usually buy Medigap or get Medigap somehow. So Medigap, Plan G that we'll focus on, G for good, just help you remember, but I think that's the one most people look to. Medigap eliminates all of your out-of-pocket expenses for the benefits that are covered by traditional Medicare after you spend the first $257. So you'll notice I have not updated that for 2026. The numbers for traditional Medicare and for Medicare Advantage that I'll show you are statutory. So it's been released. We know what those are. Medigap is actually sort of a commercial industry, and there is no yet published data saying what the average out-of-pocket will be in Medigap in 2026, but probably will be higher, but not dramatically higher. Roughly 250 or $300 out of pocket maximum is what we are expecting. And then after that, pretty much eliminates most of your out of pocket expenses for covered benefits. But Medigap does not add other benefits. It doesn't add hearing, vision, dentistry, pharmacy. You want to do that separately. In 2025, the premium averaged $160 a month. More for some people, less for some people. And we don't know what the average will be in 2026. But here's a trick that we're going to come back to again because it's so important. If you remember only one thing from this, it's my talk here, it's this fact. You have to get Medigap. If you want to count on it, you have to get it in the first 6 to 12 months that you're in Medicare. So, we'll come back to that, but there's no guarantee that you can get it after you've been in Medicare for 6 to 12 months. And we'll explain more about that in a moment. Medicare Advantage is, no premium typically in Missouri. I think the average this year was about $18 a month, but in Missouri, there's a lot of free Medicare Advantage plans. So no need, no ability to purchase Medigap. You can't buy Medigap if you're in Medicare Advantage. So you don't have to spend money on that. You don't usually buy a Part D drug benefit because almost all Medicare Advantage plans include a drug benefit. So overall, Medicare Advantage means you can save on the premiums, and they do include some additional benefits, which we're going to talk about in detail, and they're pretty attractive to some folks. In theory, if you're in Medicare Advantage, you receive all of the same benefits that are provided in traditional Medicare, all of the same benefits. In theory, but Medicare Advantage firms are allowed to make their rules about what's medically necessary. So traditional Medicare doesn't usually second guess you and your physician, but Medicare Advantage is allowed to use their proprietary double secret medical necessity criteria, which hopefully will start getting made public, but not too well just yet. But they're allowed to use their own rules of the road and decide, oh no, I know you and your doctor think you need this, but even though we've never met you, we don't think you really need that. So they're allowed to do that. That's completely legal, and that's troublesome. That's one of the things you're trading off. Every one of the Medicare Advantage plans is quite different. They all have their own copay and coinsurance design, and they all have their own everything that you could want. They typically have about a $5,000 out-of-pocket maximum. And that varies from plan to plan. Can go as high as almost $10,000, but the average is about $5,000. So because of that, at least, that's why they don't let you buy Medigap because it's not quite as necessary. Anyway, this is way too much information. You're probably, asking, that's the last email I've checked from Sandra Padgett about Consumers Council. This is way too much. So let me make it a little bit simpler. Nobody thinks about all these things. People who want traditional Medicare are attracted because they can go almost anywhere. They're hesitant because of the out-of-pocket expenses without a limit. They're hesitant because of the lack of extra benefits that are important, and they're hesitant because of the trade-off about having to purchase these other premiums. So it's the trade-off right there. How important is the extra choice versus how onerous are these little red things I pointed out? Medigap, they're of course attracted to because it helps with the payments, but then there's the downside that I alluded to. Medicare Advantage is attractive because of how cheap it is to go into, especially compared to traditional Medicare and Medigap. It's attractive because of those perks that we talked about, and it's attractive because it does limit your out-of-pocket expense. So that's kind of the whole deal. But let's come back to this thing that I alluded to about you needing to get into Medigap in the first 6 to 12 months. So in almost every state, you have that time, it's a beat the clock game. So anywhere, every year during open enrollment, even in Missouri, you can, if you're in Medicare Advantage, you can always, during open enrollment, leave Medicare Advantage and go into traditional Medicare. There is no statutory barrier to saying, I've had enough. Those problems Dr. Weisbart warned me about are actually real, and it's time for me to get out of Medicare Advantage and go to traditional Medicare. You can do that every year during open enrollment, even in the great state of Missouri. But the trick is Medigap. So most of us have this accurate sense that the Affordable Care Act protects people with pre-existing conditions. So if you go to the ACA marketplaces and you've got, and you're quite sick, if you purchase your insurance from one of the marketplaces, one of the ACA marketplaces, they can't underwrite you. They can't ask you, did you have the cancer? Do you have this, that, or the other thing? So you're protected, thanks to the Affordable Care Act, from buying, if you want to buy insurance, you're protected from any prejudice against you for having pre-existing conditions. What most folks don't realize is that that protection from the ACA disappears when you go into Medicare. That ACA protection against pre-existing conditions does not apply to Medigap. So instead, though, there's different laws that mean when you're in Medicare Part B for 6 months, those first 6 months, if you want to purchase Medigap, you can, and they can't underwrite you. They can't ask you about your med list and stuff. The first 6 months that you're in Medicare Part B, if you want to purchase Medigap, you're guaranteed that they can sell you that they will sell you a policy if you apply for one, and you're guaranteed that you'll be charged the same price as anybody in your community. That's called guaranteed issue and community rating. And that protection is extended for 12 months if you go into Medicare Advantage. So if you go into Medicare Advantage and at 11 months you decide, there's a problem here, and you want to go back, you can go back during open enrollment, and you can be guaranteed that you'll get Medigap policy at the same price as everybody else in your community. If you've stayed there for 13 months, that guarantee disappears. So you might be able to buy Medigap, but you might not. And you might be able to buy it cheap, or you might not. They can ask you your health survey questionnaire. They might not, but they can do that. And they can say, we're not going to sell you a policy, or they can say, we're going to sell you a policy if you want one, but it's going to cost like way more than you thought. So it's important to know, because a lot of folks go into Medicare Advantage when they're healthy and they think, well, if I get into some of these problems, I'll save money on the premiums for 5 years. If I run into some of these problems, then when I'm 70, I'll move over to traditional Medicare and purchase Medigap. You might not be able to do that. And so that really needs to be part of the decision that you're making. It doesn't mean don't do it. It just means you need to be thoughtful about it. But for that reason, most people who go into Medicare Advantage really can't afford to leave after they've been in it for a year. So Medicare Advantage offers these extra perks, things that are actually pretty nice to have. And the list is maybe 2 or 3 times as long. I just didn't want to use too small of a font. But they do offer things that you don't get in in traditional Medicare. And these are the things that you sometimes see advertised pretty heavily on the TV machines. So we can't unpack all of them, but let's look at what I think are the three most popular: eyeglasses, dentistry, and hearing aids, because there's things about that that I think we need to know. So there was a study about a couple of years ago that looked at how valuable are these extra benefits, and they compared people in traditional Medicare who don't typically have these extra benefits as any insurance versus people in Medicare Advantage that does claim to offer these. So dentistry, what is it worth? The dental benefit on average saves you about $23 per dental visit in Medicare Advantage compared to being in traditional Medicare without a dental benefit, about $23. That's an average for the country. So there are probably some Medicare Advantage dental benefits that are much more generous than what I'm going to unpack for you. There are some that are even worse because that's an average. So on average, the dental benefit saves you about $23 per dental benefit, per dental visit. How can that be? Well, it's because they don't cover very many dentists. Most dentists don't participate in this. So a lot of people who have a dental benefit from Medicare Advantage find that in order to use the dental benefit, they would have to travel an hour or 2 hours and not go to the dentist that's, 10 minutes away from them. And dental visits, not everybody wants to travel that far to get their savings on the dental benefit. And so a lot of people who have the dental benefit don't use it, and they pay out of pocket for dental care despite having that as a benefit. The average dental benefit, like the majority of them, stops at about $1,000 a year. Some go up to 4,000 or even higher, perhaps. But the most common dental benefit, in the fine print when you read it, which I did, stops at about $1,000 benefit a year, which, there's a whole lot of dentistry that you might need to get that doesn't fall under that threshold. Um, they typically charge you 50% for any of the care that you need in dentistry other than preventive maintenance. So that's where you're seeing how that $23 value winds up being the reality. And then they just have lists of things that are hard to find, but they simply don't cover. Or if you have them, you can't have them as a pre-existing. You have to prove that this is a new problem since pre-existing conditions applies, or that if you have it, you have to wait 2 years to deal with your dental pain. So these details vary wildly amongst the plans that the Medicare Advantage corporations offer. But at the end of the day, that's why, even though you have dental insurance, the average for the country is not quite as generous as you might think from the advertisements for it. I'm not going to unpack it in detail, but there are similar issues with eyeglasses and with durable medical equipment. So this hearing aid example is really for all of durable medical equipment, of which hearing aids is the biggest piece, the most commonly used piece. So it's not as robust a benefit as you might think. And then there's the issue of they like to get in the way of care. So let me tell you about something from that I had happen with my wife. And again, not to worry, I have Cindy's permission to tell you this story. So my wife Cindy needed to get a high resolution CAT scan of her chest, and not to worry, she's quite healthy. So things turned out, there's a happy ending kind of to the story. But she needed this test of her chest. And no, I'm not stupid enough to be her doctor. I don't do that. Her physician said that that's what she needs. So I'm the logistics person. So I went and got on the phone immediately and called radiology and said, hey, I need to get this high resolution CAT scan on my wife. And the first question they asked me was, well, what kind of insurance do you have? And I said, oh, well, we have traditional Medicare and Medicare Plan G, Part G for Good as our supplemental policy. And they said, well, great. What time tomorrow do you want to come in? America. So I scheduled the appointment, and that was great. And then before I hung up, I said, so, hey, why did you ask me that? And the receptionist said, well, because if you had said anything other than what you said, we would have said, give me your name and phone number, and I'll call you back in a week or two because we have to get approval from her insurance company. So, I don't know about you, but we weren't, it wasn't like, well, we could go to the movies this afternoon or we could go get a CAT scan. No, she needed this CAT scan because we were scared. There was something bothering her that seemed like it could be pretty ominous, and we were scared. So having to wait a couple of weeks would have been nerve-wracking. It also it would have been annoying too when you think about the fact that the only reason we would have had to wait was because somebody was trying to make sure that they weren't spending money on healthcare for us. And then it's actually potentially quite dangerous, as I'm going to show you in a moment. So Medicare Advantage requires these prior authorizations quite often. Actually, almost every Medicare Advantage company requires some sort of prior authorization. Um, and they vary, but they all, and again, the list is longer, but I didn't want to overwhelm you with a tiny font. And it's growing, actually, it's growing. So Medicare Advantage, the most recent data that I have is for 2023. And in 2023, they were averaging nearly two prior authorizations per person per year. Two per person per 1.8 per person per year. And again, these are averages. So some people who don't need any of these kinds of things don't get any prior authorizations, and they don't run into this problem. But the sicker you are, the more high-end stuff you need, the more you get. Some people run into like 10 or more per year. Some people that need to get prior authorizations for a skilled nursing care may actually wind up going through the approval process for 2 weeks and then getting it approved and then finding out that approval that took 2 weeks to get is going to expire in 3 days and having to do it again and again and again. So it's really a pretty painful, onerous process getting these approvals. And as I said, with my wife, it would have been terrifying. So this is pretty common and growing in Medicare Advantage. At the moment, it's actually almost unheard of to go through this in traditional Medicare. In traditional Medicare, today, for every 100 people in traditional Medicare, one goes through prior authorization in a year. So it's just not something that's done today in traditional Medicare. Most of the time, if you appeal a denied prior authorization in Medicare Advantage, the majority of those appeals get approved on appeal. It's hard to do the appeal. Not everybody knows how to do it. Everyone wants to go through all that work. Not everybody knows that they can go through it. You need your physician's help. It's a pain in the butt to go through it. But the majority of the appeals of denials in Medicare Advantage are approved because they were denied for reasons that are inappropriate. Those of denials have been shown to be for things that would have been approved by Medicare and that they should not have been denied for. So most of the appeals in Medicare Advantage do get approved, but it takes a lot of time and work and heartache. In traditional Medicare, if you try to appeal a denial, you're probably not going to win because unless you have information that they didn't have, because traditional Medicare isn't trying to make money off of you, they're just trying to follow the rules. So this might be changing. This might be changing. The Medicare Innovation Center is launching this new thing they call Wiser. I call it dumber, but they call it Wiser, Wasteful and Inappropriate Service Reduction. It's a new thing that they want to launch January 1st, 2026, in 6 states, not in Missouri yet, but in 6 states, where they're going to introduce prior authorizations by a lot of the same corporations, by a lot of the same vendors into traditional Medicare using AI and all this happy stuff that I've just told you is being done in a way that is inappropriate. But they're planning to launch that same stuff into traditional Medicare in 6 states, and they're going to pay. They call it a fee. I call it a bounty. So these aren't Medicare Advantage model. So they're not prepaid. This is a model where every time they say no, every time they block a service, they get paid a bounty. They're going to get the AI system is going to be paid, or people who own that system are going to be paid a bounty for every time they block your care. So the way the Medicare innovation programs work is that they are allowed to start with a handful of programs. I think they're going to have a dozen things that they're going to start with, and they can on their own expand it as widely as they want, and they can bring it right here to Missouri when they decide they want to. So one of the things my organization, Physicians for a National Health Program, is working fiercely on is stopping this program. You can't actually stop a program that's in the Innovation Center, but we've learned recently Congress can decide to not let the Innovation Center fund the program. So we're working feverishly with Congress to get them to not let the Innovation Center spend any money on this egregious model. And we think we're going to get traction with that. Anyway, we're not sure that this is going to happen because we're trying to fight it. But anyway, that's afoot and it's a game. These prior authorizations are incredibly important. I told you that they're frightening and such. They also they also can be quite serious. So let's compare people with cancer in Medicare Advantage versus people in traditional Medicare. First off, people in Medicare Advantage have to wait longer to get from diagnosis to treatment. So if you have cancer, you probably know it's a game of beat the clock. You may have a window to be treated, and if the longer you wait, the worse the chances that your disease will have progressed to a more difficult stage, to a higher stage, and be harder to treat. So you don't want a profit-centric insurance company delaying your care. And that's exactly what happens in Medicare Advantage versus in traditional Medicare. That's dangerous to delay care for cancer patients and other illnesses too. So they're delayed. The same study showed that these folks are also much less likely to be able to use a center of excellence. Like I said, I was glad to have my mother-in-law come to St. Louis, a center of excellence, for her non-cancer problem. But people who have Medicare Advantage and cancer are much less likely to be able to go to a center of excellence. Now, to be clear, not everybody wants to go to a center of excellence. You know, if you live someplace where the center of excellence is halfway across the country, you may not find that to be an attractive thing to do because you want to be in your community. So that's the decision. But God darn it, nobody should be able to tell you that you can't. Nobody trying to make a buck off you should be able to tell you that you can't. And that makes me quite angry, as you can probably tell. And that's indeed what happens with these cancers, is that the people who have Medicare Advantage were, first of all, delayed, and second of all, redirected away from centers of excellence. And this turns out to not just be annoying, this turns out to actually increase death rates. So perhaps because of those two things, people who have these cancers and probably many other things have a higher post-operative death rate in Medicare Advantage than they do in traditional Medicare. So that's not on the TV machine ads, but you need to know that when you're making the decision. Indeed, the TV machine ads are pretty deceptive. This is a Senate Finance report from a couple years ago, and they pointed out all of these television ads that look like they're Medicare. You know, we're seeing them prop up on the screen now, and they look like they're ads for Medicare, but you need to know Medicare doesn't actually advertise. So they're not from Medicare, and the phone numbers that they display prominently will not get you to Medicare. They'll get you to an insurance agent. So Medicare actually did secret stopper calls and found out that 80% of the calls that they made to these insurance agents were either inaccurate or just incredibly misleading and insufficient. My personal favorite, because of time I've spent in the pharma industry, is when they say this: if your medication is not on the formulary, your doctor could just tell the plan and not to worry. The Medicare Advantage plan will just add your drug. That's hogwash. And this is, this is not me making a call. This is Medicare calling insurance agents, and we're told things like this, along with a bunch of other things. And they all claim, all the insurance agents claim that they're unbiased. And they'll all tell you not to worry. Trust me, I'll sit down and talk to you and figure out what's the best thing for you. And I sell Medigap and I sell all the Medicare Advantage things. And I don't care, I'm just your neutral. I'm your advocate. We'll figure out what's best for you. I'm unbiased. And they are lying when they say that they're unbiased. Let me sort of prove that. If they were unbiased, then they wouldn't have financial conflicts of interest. But actually, in 2026, the federal upper limit on their commissions for Medicare Advantage is almost twice as high as it is if they sell Medigap. Tell me that that's unbiased. And Part D, they don't get paid much for Part D. And actually, a lot of the Part D commissions are disappearing for them. So they won't tell you any of that. They'll tell you, I'll help you in an unbiased way figure out Medicare Advantage versus, traditional Medicare. And Part D, you do that. You can do that on your own. Just go to Medicare.gov. You can figure that out on your own. It's just really easy. You do that. I won't. You don't need to. You don't need me for that. I'll help you with this other one, with the Medicare Advantage question. Part D is more difficult to shop for than Medigap is. No, they just don't get paid enough to want to do that. So yeah, Tell me that this is not conflicted. And it's not just a one-time deal. For years to come, after they've signed you up for Medicare Advantage, they keep getting these commissions for years to come. And actually, there's more money that they can make on that. So there's no limit on extra ways that they get paid. It's not just the commissions. There's all these other big chunks of money they get when they sign you up for Medicare Advantage, and they add up. They can add up to more than double what the maximum is for their commissions. So that's not an unbiased situation. So President Biden, 3 years ago, or 2023, yeah, 2 years ago, proposed a rule to limit at least these other compensations, and that was supposed to hit next year to get rid of at least that stuff. But last month, the court said not so fast, and they reversed it. So these problems are unabated, unabated. And I went to the insurance training website, the National Contracting Center. It's one of the more prominent places where insurance agents go to learn about this stuff. And they actually say this. I went there just a few days ago again. They say this: if you need to know you can retire on your Medicare renewals. If you want, this is a direct quote from their website. If you want to retire on your insurance renewals, you're not going to do it selling life insurance. You have to sell Medicare. And by that, of course, they mean Medicare Advantage. So they post these numbers. If you have 500 clients when you retire, for years to come, you'll be pulling in $150,000 a year without ever working. Pretty juicy. So tell me that these agents are unbiased. And they also try to upsell you once they get you in the door by selling ancillary insurance. And so they think they have other products they want to sell you on, like hospital indemnity and long-term care and cancer and heart attacks and strokes. They try to get you to do these other things. And indeed, every third or fourth Medicare Advantage client going through an agent purchases one of these ancillary insurances and boosts their income. Here's just one of the examples. The Cigna Cancer Commission is worth $420 a year to them. So don't let them tell you that they're unbiased. That's just not true. So where do you go? I promised you I'd give you tools. And there are two places you should go. Don't just trust me. Go to one of these two places. There's the QR code. If you take up your little phone and point it at the screen, you can get the QR code. And it's called SHIP, State Health Insurance Assistance Programs, or shiphelp.org. And what this is a federally funded network around the country. So the federal government pays a handful of people to administer this in every state. So there's one in every state. There's one in Missouri. And then it's staffed by volunteers. So the vast majority of people working at the SHIP are not working there; they're volunteers there. And I've known several people who do this, and they are volunteers. they're not making any money. They've all signed complete non-conflicts of interest. They don't work for the insurance companies. They don't have any conflicted interest. They don't make any money off of you. They're just doing it because they want to help you with this complex decision. So you can go to shiphelp.org and then go to the one for Missouri and set up an appointment to sit and talk with one of these counselors. And they are not biased. They are a little bit constrained. They can't tell you most of the stuff that I just told you. They have to tell you the stuff that's sort of in the Medicare handbook information, which is a side-by-side comparison without walking through the data about some of the concerns that I gave you. So they won't tell you any of that stuff, but they will help you think through your personal finances and your personal scenario and your personal situation. And they're terrific. They're calm and very, very helpful. So you can get a meeting in person for that. Or if you tend to want to do things on the phone or online, you can go to Medicare.gov. And it's like Travelocity. I mean, it's a really terrific website where you can comparison shop, just a couple clicks and you're right there at the information you want with big icons, very easy to sort your way through. So Medicare.gov is great. Or you can go to you can call 1-800-Medicare. 1-800-Medicare. Every other phone number is hooey. Every other phone number is an insurance agent, an insurance broker with conflicts of interest, as I alluded to. But call 1-800-Medicare. Now, in truth, I have not called them this year, so I don't know if this is still the case, after Doge and all that. But until this year, at least, I've called them dozens of times, and they're awesome. They're awesome. You know, you can hear them smile. They're friendly. They're calm. Every time I've called, they've answered within just a few rings. They haven't put me on hold, I don't think ever. Great. They're knowledgeable. They will calmly and listen well to your question and give you an answer that's actually related to your question. And if they don't have the answer, they will quickly get you to somebody who does. So 1-800-Medicare, I haven't called them this year and I probably should do that, but they've been awesome. So Medicare.gov, easy to remember, 1-800-Medicare, or the harder one to remember is SHIP, State Health Insurance Assistance Programs. So that's what I would recommend you do. And I believe I have successfully saved a few minutes for us to talk. So what are your thoughts?
We don't have any questions in the chat, so if you have a question, please just go ahead, take yourself off of mute. And oh, here's one from Janet. Do you have to use an agent to sign up for Medicare Advantage, or can I sign up myself with Aetna or United Care?
Yeah, you do not need to use an agent. In fact, only about a third of people use an agent. The other two-thirds do it either through the phone or through the Medicare website. So you could go to the insurance company's website. I'm sure they'd be glad to have you go directly to them. Or probably better to do some comparison shopping at Medicare.gov if you want to go to a website. Go to Medicare.gov. Figure out the type of plan you want. And like I said, I'm recommending Plan G. There's also a high deductible Plan G you could look at that is much less expensive but has a high deductible. So I would say look at a Plan G. And then once you do that, you've got like an array of, last time I looked for myself, there was I think 44 Plan Gs in Missouri that are right here that I could have chosen from. So you can have this array of them. And every one of them has more detail you can click on, but the array shows you can sort it by premium, you can sort it by what they estimate your out-of-pocket total. You can sort it in a variety of ways and then pick the one that's at the top of your sort. Each one of them has links to more details that are increasingly hard to look through because they get more and more granular, but you can do that. So you can, if you want to look up, is your doctor in the network, even though the networks are so inaccurate, you can do that kind of stuff. So yeah, you can comparison shop rather than going to the insurance company first. If you want to go into Medicare Advantage, what you'd probably do is go to Medicare.gov and do some comparison shopping. And then once you pick the one you want, there is a click here to buy this, and so it can take you directly to how to sign up, and then that'll take you to the insurance company's website. So I would recommend you don't start with the insurance company, start with Medicare.gov, but you could, if you saw an ad on TV that really lured you in and you want to go with that, caveat emptor, do it.
So I have a question about your response. So I've been on Medicare Advantage for 5 years now. So I didn't know that the agent was getting this money every year. And like you said, they do nothing for you after you sign up practically. So can I take the money that she gets away from her just by going to the company myself and signing up now? Or will she continue to get that if I stay with the Aetna Medicare Advantage plan that I have?
I'm not entirely sure. I
Okay.
believe that they continue to get their commission unless you either change to a different broker, then
Okay.
that broker starts over at the top of the scale, or if you actually change the plan specifics of what you've signed up for. But as
Okay.
long as you don't change, I believe if you went to the same insurance company and said, I want to keep the plan, but I want to buy it from you and not from the agent, but not make any other change, I don't know
Okay.
for sure, but I don't think that would disrupt their premium. You should know that their commission. You should know that that commission does not alter your premium or your benefits. That's something the insurance company pays them, but it doesn't. You're not paying. We're all paying extra for those things because ultimately it comes out of the premiums and stuff. But you're not paying a specific fee for that specific commission.
Right. I have another question. Can I ask it, or do you want to go on to somebody else?
Fire
Okay.
away.
We don't have any other questions in the chat, so go ahead.
I had skin cancer last year, and so I went to a doctor down at SLU, and she said, yes, she could treat me. And so she did, and she said, well, you need to have the Mohs surgery, so I'm going to send you to a plastic surgeon because your cancer was near your nose. So I said, okay, fine. I said, will Medicare Advantage, Aetna pay for it? Yes, they should. They will, blah, blah, blah. I've had other patients, they pay for it, blah, blah, blah. So I went ahead and had her removed. She just did one part of the surgery. She removed part of it. Then later on that afternoon, I went to see the plastic surgeon and he sewed everything up. So I get the bill. They paid for the first part. They didn't pay for the second part. So I'm a nurse myself. I've been a nurse for 40 years. I said, what kind of bullshit is this? I said, so I'm supposed to go around and leave this gap in my face because you guys won't pay the second bill? I said, they told me they would pay. So I filed a appeal and sent it in. Well, they said, first of all, they give you this caveat. They say, well, the doctor hasn't sent in everything he needs to send in, blah, 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 you know. And then what I didn't know is, well, you only have so many days to file the appeal. And I said, well, how can I do that when I don't know, when I haven't gotten the bill yet, blah, blah, blah. So there's a trick bag there that they don't tell you about. And you think you're going to get more information on this, and it takes six to 9 months to get all this information. So that needs to be cleared up because and I'm experienced. I'm a nurse, so I have no problem arguing with them. Anyway, so to this day, I don't know if the doctor didn't, some of these doctors don't want to mess with these insurance companies. After a while, they've had it. And what I'm concerned about is some of the doctors are not going to mess with this anymore. It's like Medicare patients are not going to have doctors to treat them if this continues to go on. Do you have any solutions to this?
Yeah. Physicians and hospitals are indeed dropping out of Medicare Advantage
Yes,
networks.
yes.
They're not dropping out of Medicare. They're dropping out of Medicare Advantage. So, the obvious part of the answer is to get the hell out of Medicare Advantage and go to traditional Medicare.
I am. That's what I plan to do, but I wish I had known this beforehand.
Yeah. But the other part of the solution would be to try to regulate the insurance industry so that some of these things are not as egregious. That's a very difficult process.
Yes.
But there are packages of bills being proposed that would improve some of this. But the insurance industry has such incredible lobbying power. It's but to get out of it, you do have to purchase Medigap, and that's increasingly difficult. So, yeah, I'm sorry you went through that. But that's why we're doing this webinar.
So I have a question, Ed. Is there any way, say, if one wanted to go with Medicare Advantage, can you purchase a Medigap policy at that time? Or is that only available to people who go with traditional Medicare?
You cannot purchase Medigap if you're in Medicare Advantage.
Thank you.
I have one question. You said with the Medigap, you can get dental, vision, and all that for an extra cost, about. But how does the coverage through Medigap compare to the coverage through Medicaid Advantage?
Yeah. So when I'm talking about Medigap, almost all those plans do not include hearing, vision, dentistry, and all that stuff. So when I was saying you could purchase that, I was meaning you could purchase like from a specific dental insurance company. And I'm not too familiar. I know Delta Dental is one of them. I'm not recommending or criticizing them, but that wouldn't be really Medigap. That would be just purchasing dental insurance like you would, when you're 37 years old and not on Medicare. You would just purchase dental insurance. So that's separate. And then those, you would have to pick one that you think meets your needs. When you purchase that as a freestanding policy, you would want to look and see, is it like the one I described that's pretty onerous, or is it, a better one? And I haven't looked at the freestanding dental policies, but my guess is that you could probably find one that's better than you can find from Medicare Advantage, because when Medicare Advantage is selling you Medicare Advantage, they're selling you a whole complex suite of things, and they're sort of counting on the fact that most people aren't going to do a deep dive into every little part of the policy that they're selling you.
Yeah.
And as a matter of fact, the people who are going to do a deep dive into some part of the policy, those are the people who are going to be more expensive to take care of, and they don't really care if they dissuade you. So a Medicare Advantage, often has these really restrictive dental policies. And I suspect, but there are some very generous dental policies through Medicare Advantage. I don't mean to say that there aren't, but I suspect if you wanted to shop, independently for a dental policy, you could probably do better than most of the ones I described.
So if I wanted to drop Medicare Advantage, I just not sign up, but then I could sign up for Medigap.
You could try to sign up for Medigap. What my advice to somebody who's thinking of making that switch is to do your best to lock in from a Medigap insurance company that they will sell you a policy before you cancel the Medicare Advantage one. And you can do that at Medicare.gov. So I did this with a friend of mine just a few months ago, and we walked through it. We went through. She was on Medicare Advantage. We walked through picking her Medigap policy, and we didn't. So we found the price. We applied for it. So you go through it. You pick the one you want. You apply for it, and then they send you a specific dollar amount quote based on the health survey questionnaires that you get, and you have not yet purchased it. So at that point, you've got a specific dollar premium that they're going to charge you, and that's when you would tell the Medicare Advantage company that you want out. I guess you would probably tell the Medigap policy first, but then you would navigate that at that point. So I would recommend, and in her case, she was doing this for all the reasons that we were talking about. She was quite sick, and she was having her care completely blocked by Medicare Advantage, and she was terrified by that. So we were shopping for a Medigap for her. And because she was so sick, the best Medigap policy we could find for her was about $1,000 a month, which was way beyond her budget. So she wound up not making the switch. But it was really important to sort out whether she could be offered a policy and whether she could afford the policy before she canceled her Medicare Advantage policy. So that's what I would recommend how you approach it if you decide to do this.
Do you think the easiest way would be to go through the state insurance assistant and let them do it?
Yeah, if you like to do it in person, yeah. Then that's the main advantage is you can actually go into a room and sit with somebody who can, not hurry you and have no conflicts, and they would walk you through the whole kit and caboodle. So yeah, that's absolutely one of the best ways to do it.
Okay.
It does get pretty overwhelming.
Yeah, I've got to leave now because
Okay.
I've got appointments. But thank you very much.
And I know we're a little bit over time, and I want to be respectful, especially of Dr. Weisbart's time. Do we have any other quick questions?
Yeah, I have a quick one. This is Larry Mole. I guess a two-part. If I was going to switch off of Advantage, I do have the option of, I'm a retired federal employee. I do have the option of going back to the federal and getting a supplement, some kind of a supplement through Blue Cross or something there. But I could also, I guess, do what you just said and try this Medigap, just get a quote from them. My question is, suppose I find that quote acceptable and I get on it. Can they do this year by year? Treat me as a variable individual?
No, once you're in, they can underwrite you at the moment that you're making the purchase, but then you're locked in with whatever premium adjustments they make for the whole community, the whole product.
Okay.
But I believe for all of them, you're then in.
Okay. Do you have any knowledge or thoughts about the federal health insurance program? I mean, does that anything jump out at you, good or bad, about that?
I don't have any really deep inside knowledge on that. So
Okay. Thank you very much.
yeah, thanks, Larry.
So thank you, everybody. I think with that, we'll go ahead and wrap this up. I do want to just mention that in previous years, we, out of an abundance of caution, had given people the name of an insurance agent who we thought was objective. And then the feedback we received was that that insurance agent was pushing them toward Medicare Advantage plans. So that is why we are recommending Medicare.gov and the state's SHIP program. So thank you so much, Ed, especially for doing this. Ed does this for free. He's just happy to get this information out. And I find it fascinating. I learn something new every time I hear him speak. This will be available on our website soon. And if you'd like to make a donation, I'm putting Consumers Council's website for donations in the chat. But thank you so much to everybody for coming this morning, and really appreciate your interest in this topic. Take care.